when
Yeah.
you look at, somebody's coming in for a miscarriage, the way that that is done is very similar to what they're doing when they're assisting in someone having an abortion.
So I brought you on the show so that
Mhm,
we can talk about Roe v. Wade and access to women's health.
mhm,
Not only are you one of my good friends in jiu-jitsu, but you're also a nurse. And
mhm.
lately you've been helping out this population. And when I talked to you about it earlier, you had a lot of great insight and information that I didn't even know when it came to what women need. And it's not just about abortions. If you're not ready to have a child, it goes much more in depth than that. And one of the things that you spoke about, and actually, Tirza actually shared a really cool clip with me on Instagram, is emergency procedures for miscarriages and
Mhm.
how important that is that we have access to it. And now
Yeah.
states are making it difficult for women to have access to that
Well,
when they
and
need it.
sorry to interrupt, but when
Yeah.
you look at, somebody's coming in for a miscarriage, the way that they're going to be treating that and taking care of the female, and I mean, I'm not in there for the procedure itself, but then the way that that is done is very similar to what they're doing when they're assisting in someone having an abortion. So it is a nuanced area that you're working in. You don't want somebody, going and doing neurosurgery on you that's an orthopedist. You don't have an
Mhm.
orthopedist work on your brain, so why would we just have a woman go to the ER and just see, a generalist if you have somebody that's a specialist in the field and this is what they work on and they're able to identify, what's happening. So it's kind of a disservice in a lot of these states now where they're outlawing this, and now those doctors are kind of stuck in this weird spot. And then I don't even fully understand the whole idea of like the legal prosecution and the things that I've heard. It's kind of appalling, but at the same time, I think there were staff that I was working with that were kind of concerned, like, are we going to get in trouble if we're helping out, in this area? And then how is this going to be affected in Oregon? Which fortunately, you know, along with California and I believe Washington, our side of the country, um, that it is something that's still legal. And I mean, I think it's something that's up for debate now every time there is we're having an election. It's scary.
It is scary. Is abortion not legal anymore in Oregon, or is
No,
it
it
up
is
for
legal.
vote?
It is
Okay.
legal.
Okay.
We I know the medical staff that we have, the group that actually does a lot of those procedures at my particular hospital, was working to figure out how to help people in other areas to be able to get access. But I
Mhm.
mean, even other things that I've heard since then, because I also occasionally will go and help out our fertility clinic, is that women from other states are trying to find a way to get their eggs moved. So this Roe
Mm.
v. Wade, and I don't understand the specifics of how um, all of these things start to sort of, the dots start to connect, but it's kind of opened up a can of worms of, women's reproductive health in the sense that the legality of, freezing your eggs and wanting to get pregnant when you want to get pregnant on your time frame, because in these countries where or in these states where it is outlawed now, all of those things are being pulled into question, and these women are scrambling to try to figure out, well, where can I safely store this stuff? And I mean, that's
Wow.
expensive for someone who actually wants to
Mhm.
have a child and they can't conceive naturally. Like they need some intervention. And so it's like, I don't know. It's just there's so many, I think, directions you can offshoot with where it's affecting women's health, and we haven't even begun to see the amount of things we're probably going to lose.